On this episode of Cox Connections, Access Partnership is dedicated to improving health care for people in need in Hampton Roads. This nonprofit group works hard to develop realistic solutions for local residents who have problems with access to health care. We'll learn about Access Partnership programs today. Also, did you know that we have the 2014 USA Boxing Junior Olympic champion right here in Hampton Roads? Keyshawn Davis holds the title. We'll find out how this is a family affair and about the Olympic coach who made the dream come true. And today's libraries have more than just books and reading rooms. The newest and best libraries are charging ahead with technology in the forefront. We have one such outstanding library right here in Norfolk. Find out about the remarkable new Slover Library and all it has to offer residents of Hampton Roads. Stay tuned, Cox Connections is next.
The centers are truly designed to be homes away from home for our service members.
Our goal is to help them not just get out of homelessness, but to help them to stay out of homelessness.
We leveraged $44 million in financial aid and scholarships.
Boys and Girls Clubs and our rallying communities so that we can ensure that our kids have a great future.
Salvation Army Ray and Joan Kroc Core Community Center, a phenomenal facility that will change lives.
Hello, and welcome to Cox Connections. I'm your host, Emma Inman, Director of Public Affairs for Cox, Virginia. In February 2014, the CDC conducted a study showing that there were more than 45 million Americans who had no health insurance. Here in Hampton Roads, Access Partnership is helping residents get the health care they need. This organization offers a forum for local health care providers to identify system-wide gaps in health care. They also advocate for programs and services that address the needs of the uninsured and financially disadvantaged. Here to tell us about Access Partnership is Executive Director Candace Driscoll. Welcome to the show.
Glad to be here. Thanks for asking me.
So Candace, tell us, how does Access Partnership work with the community?
Well, we started out, we're actually a collaboration. So we started as a collaborative to bring the key stakeholders together, the users of health care as well as the CEOs from hospitals and those from the free clinics, community health centers, and we develop a forum so that we can meet and discuss what's going on as far as the gaps. If we found one of the main things that people were having problems accessing when we first started was oral health. So that became a priority for us because we were already addressing access to medical care, but the oral health care was one of the #1 barriers to care.
And how did Access Partnership come about in the beginning?
Originally in 1999, Norfolk was one of the cities that got the Kellogg Foundation grant to improve the health of their community. And what they kept seeing was access to health care. Basic health care was a huge issue. So they started meeting to focus on that. And in 2005, they officially incorporated Access Partnership to be an unbiased, collaborative nonprofit to bring everyone to the table to work on these issues together.
And can you tell me a little bit about the specific programs and services that Access Partnership offers?
Yes, we have one program called the Community Access to Care Program, and this is based on a project access model that's been implemented in about 100 communities across the nation. And so it allows those that sign up for our program to get a card. They're financially screened to show that they meet the poverty level at the point where the health systems and the physicians and the providers of health care will agree to see them or can see them at their charity level. And so we sign them up, we educate them on how health care works, how the program works, and then when they see their primary care doctor, whether it's a clinic or a community health center, then they can go and have their diagnostic care and see specialists that wouldn't be available to them otherwise.
Sounds like an incredible program. Can you give us an example where Access Partnership made a real difference to someone that you serve?
Well, on the medical side, we've helped people that waited until they knew that they weren't going to get a big bill, because all our health systems have a charitable program in place, but it's usually prospective or retrospective. And so people are hesitant to go in and utilize the services and then find out they don't qualify. So we do it prospectively, where we financially screen them and show that they do qualify before they access services. So many of them will enroll in our program and then go in and have the testing they need. And we've had one that found out that he had prostate cancer and was able to get that taken care of. Another had colon cancer. Another had throat cancer. But they had delayed care until they knew they had access and they could afford it. And then on the dental side, we've made great strides on the dental side. We have a program called Donated Dental Services that we collaborate with the Virginia Dental Association on. And it's private dentists that are willing to see a certain number of uninsured in their offices. And it's for the disabled, the elderly, and those with complex medical conditions. We had a very nice young man that was 33 years old, worked every day, had medical insurance but no dental insurance. And he had developed diabetes as a 10-year-old. And then as years went on, he went into kidney failure, which is a side effect. And he wanted a transplant, but they won't put him on the transplant list until their oral health is addressed.
Absolutely. As oral health has such a key, it plays such a key role in your medical health.
So he got his teeth taken care of, and now he's waiting for his transplant.
That's fantastic. How can people learn more about your programs, and is there a way that people can get involved and assist you?
Well, we always have volunteers. We get a lot of student interns, and we're very grateful for the student interns because, like all nonprofits, we survive on grants and donations. And so when people volunteer their time and talents, that's a great help to us. But we're available on the internet, www.accesspartnership.org. We also have a Facebook page, LinkedIn page, Twitter. We try to be
very social.
Yes, so that people can find us. But we usually, like anyone else, it's hard to advertise. The needs are so great. We want to be certain that we can handle those that we're caring for. But we get a lot of calls, and we give them to we connect them to the right resources. If we don't have a program in place, we know who does.
So you mentioned dentists volunteer their services. Is it just medical professionals who can volunteer to assist you, or do you need other types of volunteer assistance as well?
Well, we always can use people with IT and web design, or those that have marketing. We want to do a really nice annual report, but that's just not a priority for us right now because of the time and the expense. So we run very basic, and we want all our money to go into the programs to serve more people.
Absolutely. Well, it sounds like you are really making a tremendous difference, strengthening the safety net in our community. So thank you so much for everything that you do to help those in need in Hampton Roads.
Thank you.
And thanks for being here today.
Absolutely. Thank you so much.
Coming up, Keyshawn Davis may be only 15, but in July, he claimed his 4th ringside champion boxing title. He now holds 8 national titles. His brothers hold titles too, all with the help of U.S. Olympic boxing coach Gloria Peak. Find out about this amazing family and their coach. Stay tuned for more Cox Connections.